Hi, my name is Sofia Chinchilla. I am a summer intern at the Cleveland Clinic. I'm in the Science Internship Program. I'm entering my senior year at North Olmsted High School, and I'm working in the Emergency Department with Dr. Sharon Mace at Main Campus. We did a study on the characteristics of an emergency medicine-led rapid response team in an academic tertiary care hospital in the United States. In 2008, an emergency medicine-led rapid response team was started by the Cleveland Clinic. It's known as the Adult Medical Emergency Team, or AMET. AMET is staffed by a physician, nurse, and a respiratory therapist. The team must arrive at the patient's bedside with proper tools within 10 minutes. The requirements for a call include abnormalities in the patient's cardiac, respiratory, and neurologic systems. If the characteristics of a common AMET calls are known, the AMET equipment and staffing can be properly adjusted to suit the needs of the patient. Charts were analyzed retrospectively on all of the AMET calls of 2008. That's a total of 959 patient charts. The variables looked at include reason for call, gender, race, ethnicity, age, location of the patient in the surgical subspecialty, the time of calls, the number of patients each day of the week. The calls gradually increased with a spoke in July and then averaged to 90 per month. The average age of most of the patients was 61.4 years, in a range of 15 to 99. 48% of the patients were female and 52 male. 71% of the patients were Caucasian, 25% African American, and 4% other. In the top left corner, you could see the race demographics separated in a pie chart. As you could see, the majority are Caucasian, followed by African American, unknown, Hispanic, and Asian. In the top right corner, you could see the chart for the difference in gender. The blue is male and the pink is females. At the bottom, you could see the chart for the age separated by decades. As you could see, most of the patients are over 50 years old. The reasons for call include 41% respiratory, 20% neurologic, 19% cardiac, 17% blood pressure, and 3% other. Amongst the respiratory calls are 26% abnormal respiratory rate and 15% decrease in oxygen saturation. Cardiac calls include bradycardia or tachycardia, 16%, and chest pain, 3%. Neurologic calls include loss of consciousness, 11%, lethargy, 5%, sudden collapse, 3%, and new focal weakness, 1%. You could see all the different reasons for call in this chart right there. We concluded that over 75% of the patients were older than 50 years and 25% between the ages of 60 and 70. Gender and race were appropriately reflected by our results. The majority of the calls were respiratory, followed by neurologic and cardiac. Some of the benefits to AMET include increased throughput for ED patients due to additional ED staffing when team members were not on call, maintenance of technical skills by ED staff, and increased teaching for medical and surgical residents by the attending staff. Knowing that the majority of AMET calls are for respiratory, airway, and cardiac problems, AMET can be readjusted and the equipment can be varied accordingly. For example, for cardiac abnormality, an EKG and bedside testing equipment could be used to test vital cardiac enzymes. I would like to thank my mentor, Dr. Sharon Mace, my peer mentor, Andriana Stevens, and my fellow interns, Natalie, David, Claire Lowe, Emily Richards, and Stephen Steffes, in the Office of Civic Education Initiatives.